Everyone please participate. Participant rate খুবই কম, only 2%. Anonymously participate করা যাবে। One minute more. Option A, high tensile strength. Option B, high capillarity. Option C, non-allergenic. And option D, good knotting properties. High tensile strength, non-allergenic, and good knotting properties, all are the properties of ideal suture material except option B, high capillarity. 74% students answered correctly. Question 2. Which of the following suture is observable? Option A, polydiagonal, that is PDS. Option B, polyester ethibond. Option C, silk. Option D, linen. Polydiagonal PDS is observable, others are non-observable. 80% students correctly answered. Question 3. Primary advantage of monofilament suture over braided suture is Option A, high capillarity. Option B, lower risk of infection. Option C, better knot security. Option D, higher flexibility. Here, primary advantage of monofilament over multifilament is there is lower risk of infection. That is option B. 81% students gave the correct answer. Question 4. Which suture material has the highest tensile strength? Option A, proline. Option B, nylon. Option C, PDS. And option D, monocryl. Correct answer is option A. 59% students answered correctly. Question 5. Why is chromic catgut treated with chromium salts? Option A, to reduce allergic effect. Option B, to reduce cost. Option C, to resist degradation in tissue. Option D, to enhance knot security. Correct answer is option C, to resist degradation in tissue. Majority answered option A, to reduce allergic effect. It is wrong. Correct answer is to resist degradation in tissue. 44% students answered correctly. Question 6. Which suture material is most suitable for biliary anastomosis? Option A, chromic catgut. B, proline. C, polyester. D, vicryl. Correct answer is vicryl. 74% students gave correct answer. For biliary anastomosis and urinary anastomosis, usually absorbable suture material is used to prevent stone formation. 74% students answered correctly. Question 7. Which is the material of choice for abdominal wall closure? Option A, PDS. B, vicryl. C, polyglycopone, that is monocryl. And option D, proline. Correct answer is option A. PDS is the suture material of choice for abdominal wall closure. 62% students answered correctly. Question 8. Which factor is the most critical for preventing wound adhesions? Option A, use of monofilament suture. Option B, avoiding strangulation of tissue. Option C, selecting the smallest possible suture size. Option D, suture to wound length ratio of 4:1. Here, most critical for preventing wound adhesions is option D, suture to wound length ratio of 4:1. Majority answered option B, avoiding strangulation of tissue. This is not true. This is the common factor for all types of wound adhesion, but most critical factor is suture to wound length ratio of 4:1. Question 9. Ideal time to remove facial suture is option A, 3 to 5 days, B, 5 to 7 days, option C, 7 to 10 days, and option D, 10 to 14 days. Correct answer is option A, 3 to 5 days. 69% students answered correctly. Question 10. Which tissue thickness is best managed by a blue cartridge in a linear stapler? Option A, mesentery. B, vascular. C, bowel. D, lung parenchyma. Blue cartridge is used for bowel anastomosis and resection, also stomach. Option C is correct. 88% students gave the correct answer. Question 11. Which complication is most associated with overcompression of tissue by a stapler? Option A, staple line dehiscence. Option B, tissue necrosis. Option C, anastomotic stricture. Option D, bleeding. Here, correct answer is tissue necrosis. Overcompression leads to tissue necrosis. 69% students gave the correct answer. Question 12. Which of the following is a single fire, single patient use stapler? Option A, linear cutting stapler. B, circular stapler. C, curvilinear cutting stapler. Option D, endoscopy linear cutter. Correct answer is option B, circular stapler. This is single fire, single patient use. Cannot be reused. 63% students gave the correct answer. Question 13. When stapling erythematous small bowel, what technical adjustment is most important? Option A, using larger staple lines. Option B, selecting larger staple height. Option C, increasing compression time. And option D, decreasing firing pressure. Correct answer is option C, increasing compression time. 47% students answered correctly. Question 14. If a stapler misfires during left right hemicolectomy, the first step should be option A, convert to open procedure. Option B, attempt to refire the stapler. Option C, inspect the staple line integrity. Option D, apply hemostatic agents. Correct answer is option C, inspect the staple line integrity. 71% students answered correctly. Question 15. The ideal compression time before firing a linear stapler is option A, no compression is necessary. Option B, 5 seconds. Option C, 10 seconds. Option D, 15 seconds. Correct answer is option D, 15 seconds. This is the ideal, minimum ideal compression time before firing a linear cutting stapler. Last question. What is the primary advantage of powered staplers over manual stapler? Option A, lower cost. Option B, reduced staple line bleeding. Option C, consistent firing pressure. Option D, faster absorption of staples. Correct answer is option C, consistent firing pressure. 64% students gave the correct answer. Here I have only given the correct answer, expression will be told later on during presentation. So that's all from us. Thank you.
Okay, thank you, Dr. Nulaman Bhaiya, for nicely moderating the poll. I think well-designed questions. স্টুডেন্টের আনসারটাও ছিল ভালোই, পার্টিসিপেন্ট 124 এর মধ্যে 80 রেসপন্ড করেছে। আমার কোশ্চেন স্যার, স্যার প্লিজ মেক
ভালোই জানে।
ভালোই জানে স্যার, হ্যাঁ। স্টেপলার মোটামুটি ভালোই আছে, নলেজ আছে। তো হাউএভার কিছু এরিয়া মানে কনফিউশন আছে, যেগুলো একটু প্রেজেন্টেশনের সময় ক্লিয়ার হয়ে যাবে। তাহলে প্রসিড করি স্যার আমরা।
শুরু করে দিন।
থ্যাংক ইউ স্যার।
টার্গেট কি আজকে কতদিন, কয়টা?
না স্যার, আজকে আমার ম্যাক্সিমাম স্যার 10:30 মধ্যে শেষ হয়ে যাবে। আজকে আমাদের শর্ট আছে 10:30 স্যার। ওকে, so our next part of the presentation হচ্ছে interactive type of presentation.